The head and neck grid was developed to help streamline a process. And the process was to follow these patients from the time they finished treatment for the next 5 years plus out. Head and neck cancer is very complex, with the patients needing to see a multitude of different providers. So it could be very difficult to schedule these follow-ups. With so many providers being involved in the follow-up care of these patients, we didn't have enough room. Some doctors were taking longer than others. We were getting backed up. It wasn't efficient at all. So this patient was coming back all the time. So we needed to come up with a system that we could streamline this process, not only for the patient, but for our doctors. I had done a little study. I took a population of 10 of our head and neck cancer patients, and I went back 2 years and I looked at all the appointments that they had, how many times they came in, who they saw, and how much time that took, you know, off of our doctor's time. With this study, I found that the patients were coming in a lot more than they really needed to. A lot of these appointments were just kind of a look-see, looking at the patients, but they didn't need to come in for all the appointments that they were scheduled for, and that we could have opened up those slots for the doctors to see new patients or other follow-up patients. One of our surgeons, Dr. Pedafar, he actually said, you know what, these patients, as long as they're seen, they don't need to be seen by all of us every single time. So Karen Scala, who is a nurse practitioner, with the approval and the help of the others, put this grid according to when the patient really needed to be seen. The grid is basically an Excel spreadsheet that we look at, and we determine where the patient is in their care pathway, in their treatment, and we kind of plug them in to where they are. And we can actually book them out for the next 5 years if we need to. So basically now, all of our doctors who see these patients, at the end of their visit, they don't have to think about when they're going to come in next. At the end, they just put follow-up per grid. And now the secretaries can look at that. They can look at the spreadsheet. They know when the patient needs to be seen and by who, and what testing or imaging needs to be done at that appointment. At first, it was a little difficult for the patients, some of them, because they thought they did like the fact sometimes that they were seeing every single provider every time, but a lot of them didn't like it because it was kind of a nuisance. They were traveling a long distance to get here for a very quick appointment when they were doing well. So we've had some mixed reviews from the patients, but now they seem to really like it. We just tell them we'll be in touch with you. We can actually give them a 5-year plan now, which they really like. We can actually give them a copy of the grid if they want it, and then they know when they're going to be getting phone calls to be coming in for that particular month. This isn't a cut and dry grid. This is also, you know, our patients do get sick. They do have reoccurrences. They may kind of fall off this grid for a little bit, and then there's a discussion that takes place. Where are we going to put them back on this grid? Where are they now? Do we need to see them a little bit more frequently? And we have to alter those according to where the patient is. It makes it difficult for us sometimes because we're not on the same unit. We're on different floors. We have different secretarial staff. So it was a lot of communication, and we're still doing that. We're still seeing patients come in that haven't been seen in, you know, they're maybe 5 years out now, so they're just coming in for their yearly appointments. So we want to make sure that we catch these patients. We make sure that we know where they are in their follow-up plan. We all just work together now as a group as patients come in. The larger project, which is called the Head and Neck Cancer Care Pathway, is just an overall path from the time the patient walks through the door till the time they're finished treatment. And that would involve option grids for them, deciding what treatment plan they want to go with. It may involve their inpatient stay, length of stay in the hospital. So it's just a much, much broader care path for the patient. Our follow-up grid is just a very small piece of that grid, but it does fit into that grid. We've only been at this for, I would say, maybe a year now, so we're still getting patients who are coming in for follow-ups who are not on our grid yet, so we're still adding patients. We're still working with it. It's a work in progress, but this has been a complete team effort from everybody in the interdisciplinary team, from the secretaries, nursing staff, nurse practitioners, all the physicians, providers, everybody has been on board with this. We have met, we've worked together, and we've done this as a group. And by doing so, that's what's made it successful. And our doctors are really liking it, that they don't have to figure out on their discharge summaries or their after visit summaries when the patients need to come back. They can just put follow-up per grid, and then we take that information from there. The secretaries, and they know the grid now, they've worked with it, and they just plug it in, and it's wonderful. It's a great system.